So, how safe it is if kids swallow the toothpaste? You know, many of them don't have that motor planning or that ability to spit out. So, I mean, just let me know what you feel about it.
Yeah, this is a main problem for small infants as well as children with special needs. And any toothpaste for that matter, if used in larger quantities, is not good if swallowed morning, night, throughout the day. So what can be done is using a small amount. Pea-size amount of the toothpaste also can give benefits to teeth, and therefore the parents can use pea-size amount, which when the child swallows will be in very small quantity. If possible, they can also wipe out with cotton if there is excess of toothpaste in the mouth.
Okay. Would you let us know about the fluoride toothpaste?
Before answering that question, I will start with how the decay begins. Cavities, as we say, which is called also called as dental decay. When we eat carbohydrates, sugary foods or sweets, there are germs or bacteria in the mouth. They will use these carbohydrates for their energy, and in doing that, in the process, the acid is formed. When acid is formed, it will start dissolving enamel, the outer cover of the enamel, outer cover of the tooth, and this is basically the ions, which are molecules which are there in the enamel, like calcium, phosphate. They start leaching out of the enamel. Enamel becomes
then nothing is left.
Just in smaller quantities from the subsurface area, and enamel softens. This is the initiation of a cavity or dental decay. As this process continues, the surface will form a cavity, and then the food will accumulate in that cavity, and this cavity will grow. This is called dental decay. Now each tooth has nerve inside. The nerve, the blood vessels, there is a live tissue inside a tooth. When this cavity grows, it starts affecting the live tissue, which we call as dental pulp. And this pulp gets affected. First there is inflammation. Then this process continues to infection, where pus is developed. And then the tooth, you might have seen many children with tooth which is swollen. So that happens. The tooth starts paining, and it is said that dental pain is one of the worst pains. So I mean, that continues. So this is the process of dental decay. Now fluoride is one ion or one molecule which is helpful. So when these ions are coming out of the enamel, there is calcium, phosphate and fluoride ions, calcium and phosphate ions in saliva, which also will try to go inside the enamel and try to strengthen the enamel. Okay. Fluoride is one such molecule which will even strengthen the enamel more, and therefore fluoride is beneficial. Fluoride in the toothpaste is beneficial. If fluoride is consumed in larger quantities, and it is absorbed in blood, then it becomes toxic. But when you use it with toothpaste in moderation, as recommended, in pea-size amount, or the child is able to spit properly, then it is not poisonous. It should be used.
Okay. And what are the specific foods that cause dental decay?
So any food that has carbohydrate, that can be categorized as carbohydrate, has potential to cause decay. Now, for example, biscuits. Everybody knows about sweets and chocolates and candies and all these. But do we really know that biscuits also cause cavities? There are nowadays so many children are eating biscuits every day. And biscuits are starchy, they are pouched in the mouth, they remain on the teeth for a longer time, and therefore they do cause cavities. Bread, jam, all these food items which have carbohydrates in them, pastries, cakes, all these will cause cavities.
Okay. There are some kids who, pocket their food. Is that a dentist thing or is it a sensory thing?
It is basically, I think, sensory thing. Their swallowing function is not well developed, and therefore they are not able to swallow the entire food that forms a bolus that is not swallowed properly, and therefore they pouch the food in their mouth. And that is the reason why if your child is doing something like this, it is very important that the mouth is cleaned after every meal. It is very important.
And that will in fact even affect their speech development, articulation, clarity.
Yes, if the swallowing is not proper, that means the position of the tongue, the function of the tongue is not proper. In that case, it may cause speech impairment.
Many children do a lot of teeth grinding also. We know that there's a lot of proprioceptive input that they need. As a dentist, I wanted you to know your opinion. Does that damage teeth, or how as a dentist would you be able to help or suggest to parents?
Yes, teeth grinding problem is very common, and in severe conditions, teeth are worn off. Yes. And what happens is sometimes they are abraded so much that the live tissue inside the tooth also gets exposed, and it also puts a lot of stress on the TM joint, the joint of those two jaws, and therefore it has to be treated. Now what can be done? There is a plate that can be constructed for a child, and the child can wear it so that they do not get this proprioceptive proprioceptive stimulus from grinding of the teeth, and therefore that can be.
Oh, I didn't know this. But what is needed to get that done for a child?
To make this plate, impression recording has to be done of the teeth, the top teeth, bottom teeth, and this plate will have to be custom made for the child. It is a soft kind of a plate which child has to wear. There is no risk of child choking on it or anything. But when the child wears throughout the night, what happens is child will feel less and less urge to grind the teeth.
It's a fixed thing?
It is not fixed. It has to be worn only during the night.
Okay.
But it hugs the teeth properly so that it can be retained nicely on the teeth.
Okay. When is it that parents should take their child to a dentist? When exactly should that start happening?
For any child, it is recommended that as soon as they have their first birthday, they should take the child to a pediatric dentist. We have a concept called dental home, where we establish a place, a dentist clinic, as a familiar place for a child, small infant, where child will visit year after year, and parents also can have their questions answered. And there are so many questions that parents have, right from when to start, how to start brushing, to what are the problems that occur when the teeth are coming in the mouth, how they should prevent fractured teeth, trauma to the teeth. So many questions are there, and so these questions can be cleared. The parents can already be told what they can expect for next few months from the child's erupting teeth, because otherwise it is completely unknown area. Many times I have seen a child falls, injure their teeth, and parents are not aware what should be done. So if they are already told what they can expect from a growing child, they can manage these emergency situations much better. So that is how we call as dental home, and this is the age where we can begin the preventive treatment.
But kids are so scared to go to a dentist. The sound and the drilling and all, they're too scared. So how should they prepare them?
Yeah, so that is the reason they should bring, even before they have problems, they should bring the children to a dentist. But if they have not done that, and if the child has a problem and they need to bring the child, the first and foremost thing is they should not tell them anything which is scary. They need to just tell the child that we are going to visit a dentist and dentist will check your teeth. That's it. Maybe that time, depending on the age of the child may comprehend, may not comprehend.
Yeah.
And then it is up to dentist how he or she makes the child cooperative. That is the area of a pediatric dentist. We are skilled to manage the child's behavior. We know what exactly to expect, what kind of behavior to expect from a particular age child.
Yeah, even if it is a child who has special needs.
Yes.
Yeah. Okay.
I mean, that is very well put, because they will have their specific problems related to their condition, and we are skilled to understand and comprehend and manage these children. Between every 3 months to 6 months, a child should visit a dentist, and at that time some of the preventive therapies can be done, and fluoride treatment or fluoride therapy is one of them, where child's teeth are cleaned and fluoride, either fluoride gel or fluoride varnish is applied on the teeth. And this fluoride, as we discussed earlier, will strengthen the enamel and prevent dental decay. There is something called as sealants as well, fissure sealants or dental sealants as they are called, which is a coat which can be placed on chewing surface of molars. Chewing surface of a molar has deep grooves on them, some of the molars, and when child eats, the food gets stuck inside, and many times with even regular toothbrushing it will not come out. So such teeth, this fluoride, this sealant coat can be given, and which will prevent dental cavities.
Okay. You know, many parents ask me that the kids' teeth are yellowish and their mouth smells a lot. So is that also related to the condition?
Yeah, now yellowish teeth could be because of the stains that are developed outside, or deposits that are developed outside because of poor brushing of child's teeth, and that can be cleaned by doing scaling and oral prophylaxis. Yes, scaling is required
for kids also.
Yes. If there are certain teeth which are yellowish in nature, which is intrinsic color of the tooth. But anyway, if there are deposits, they need to be cleaned. After cleaning, whatever is the natural color of a tooth will show. And this cleaning should be done every 3 to 6 months. Scaling is a specific term where deposits are formed or where calculus is formed. It is removed with scaling. More importantly, we do oral prophylaxis. Oral prophylaxis is using just a small brush on the electric drill that we have and removing the plaque from the teeth surface. And that should be done every 3 months to 6 months for a child.
Many children have this habit of putting everything into their mouth. I know it's sensory in nature also, and sometimes nutritional. I would like to know your perspective about it.
Yes, children who have sensory processing disorder or whose mouth is hypersensitive, they do have this habit, and that will affect if the child is chewing on some hard object, because like some children have a habit of putting hard objects in the mouth and chewing on them, and that will lead to fractures of the teeth, the front teeth. They cause more stress on the teeth, and sometimes teeth become loose. I know one child who had a habit of chewing on a hard object, and his front 2 teeth were quite loose because of that. So that I have seen before. Sometimes they have a habit of sucking on their fingers or thumb, and if that is done frequently and with a lot of force, the teeth start jutting out, and the treatment will have to be done for that. But before any treatment can be done for alignment of the teeth, first the habit needs to be stopped. So children who have sensory processing disorder, they first should be seen by a dentist, of course, but by
a therapist. Is it a good idea to cap the milk teeth if there are cavities?
Yes, I mean, if the dentist has advised tooth needs to be capped, then it should be done, and that is for several reasons that dentist will advise such a thing. Sometimes when decay involves many surfaces of a single tooth, the tooth becomes very weak, and any filling material that you will place in that tooth will not be retained for a long time, and therefore they may advise to get the tooth capped. Sometimes when the decay has gone so down to the pulp, the dental pulp or the live tissue or the nerve inside the tooth gets infected, and then the nerve treatment or root canal treatment needs to be carried out for such a tooth if required, and when that is done, the tooth has to be capped. So yes, milk teeth need to be capped many times, and that is the best possible restoration. It will stay longer, it will the cap will stay on the tooth till the tooth falls, and giving a cap or doing a root canal treatment for a milk tooth is going to only save that tooth, and it is not going to affect falling of this tooth or the new tooth which is coming out. It is not going to affect that. So if it is advised, yes, you should get it done. It is a permanent solution for that particular child.
Some light on the tongue tie, the anterior tongue tie and the posterior tongue tie. So, if you can help us.
Yeah, tongue tie basically, see, tongue is attached to the floor of the mouth by some tissue, and usually it is such that tongue can move freely. But sometimes in some children this attachment is quite fibrous, quite thick, and therefore movement of the tongue is not normal in these children, and if so, then speech becomes a problem. Wherever tongue has to touch the teeth for pronunciation of some letters, that will not be pronounced properly, and therefore some treatment needs to be done. So if there is a tongue tie, it should be diagnosed properly. If it is causing any problems, that needs to be surgically excised. It's a minor procedure but needs to be done in some children.
A dentist does that?
A dentist, pediatric dentist or oral maxillofacial surgeon also can do that.
Okay. Can you give us some idea about these electric toothbrushes that are available?
Yes, some children who have sensory processing disorder, they can be benefited by using this electric toothbrush. And we had discussed earlier about children refusing to brush, and for such children, power toothbrush or electric toothbrush can be used with a lot of benefit. So yes, I will recommend.
So the parents do it or the kids do it?
If by maybe age 6 or 7, till the child develops skills to use the brush on their own effectively, that dentist should decide. Then till that time the parent should use. After that the child can use it. See, now whatever I have shared, all the information that I have shared is for general purpose. Many children have specific problems, and there would be specific answers to these problems. So any problem the child has, if you have any questions, I think you should find a good dentist, preferably a pediatric dentist who is skilled to answer your questions, to view, to examine your child, to find out, to diagnose what problems the child has, and they will discuss. They are more skilled, the pediatric dentists are more skilled to manage your child's behavior, to manage the child's condition and render the treatment that is required.